now it's Thursday out of the 8:30 news. Time for What's Up, Doc, where we spend some time with the healthcare experts at Mercy Health. This morning is no exception. We're talking family medicine and primary care, and we're doing that with Dr. Yaser Mustafa. Dr. Mustafa, good morning to you.
Good morning. Thanks for having me.
How's everything going this morning?
Good. How's everything with you guys?
We have no complaints. How'd you get roped into this?
I mean, I don't know what to tell you.
That's somebody walked into the office and went, "It's your turn this Thursday, doctor."
It's the most honest response we've gotten to that question.
Yeah. Yeah, we've had others try to demur and say they weren't forced into it. They didn't draw the short straw.
I'm glad. I mean, it's an honor to be part of this, so I look forward to.
Tell us a little bit about you.
Basically, I'm actually here at the Mercy Health Perryville Clinic. I'm a primary care physician. I also work at urgent care here in the same building. And so that's kind of my two areas that I specialize in.
What got you interested in becoming a doctor to begin with?
Just, I mean, to be honest with you, being able to help people make a difference, make an impact in society, and that just kind of sums it up, to be honest with you.
How long have you been in the Rockford area?
Rockford, I mean, I've been here for 3 years living here, but I used to work actually up north in Janesville. Before that, that's where I did my training. And I've been here now working in Rockford for the past, since July. So, yeah, but I like it here, It's a little bit cold. That's kind of the only thing I hate about this place. But otherwise, I think it's a good place to live in,
That's all right. That won't alienate anybody. We all feel the same way. We just tough it out year after year after year.
Yeah, we hate it too. It's fine.
I keep thinking, I gotta hit somewhere south, but I don't know. It's just once you get used to an area, it's hard to do that, So
that's very true. Very true. For people, we hear the term all the time, family medicine physician. Give us a broad overview of what that means.
Yeah. So basically, I mean, to put it in easy terms, a family medicine physician is someone that takes care of the whole family. Essentially, that includes children, adults, males and females, pretty much of any age. Unlike other physicians that may focus on one specific illness or disease, family medicine physicians basically focus on the entire health of the patient, and they take care of everything pretty much. So that's kind of what sums it up.
Did you get into family practice because you couldn't find a specialty that you liked enough to specialize in, or do you just really enjoy the family aspect of it?
I really enjoy the family aspect of it and being able to really treat everyone from any age, any gender, and really you get to build a relationship with patients, in family medicine, and you don't see that with other specialties. I mean, some specialties do, but I mean, overall, I think family medicine, you really get to do that. And I enjoyed that. It's rewarding. I really get to enjoy that every day.
At one point before my doctor selfishly retired, our entire family had the same physician. My parents, my wife's parents, my wife and I, and then our kids. We all went to see the same person. Yep. And there's something that is very helpful and comforting about somebody who knows all about your family.
That's true. Yeah, that's true. And you build that connection. It becomes much easier to follow up with them. They know you. You know them. It's just it's easier. It makes it easier for the patient and the physician too. So.
But remember, how difficult it then is for your patients when you selfishly retire. Because then they have to go out, they have to audition some new doctors, that kind of thing. It's time consuming.
I don't know about selfishly retire. I mean, it's not.
I'm sure he would disagree with the selfishness on it, but he's not looking at it from my angle.
Yeah, I guess I get your point, and it's hard. I mean, like we have here Dr. Diamond actually, who's retiring, and I'm taking over his patients, and I see that. I mean, a lot of patients are saddened by it. I mean, especially when you have that relationship with your physician, it's hard. It's not easy. But you got to move on sometimes.
You absolutely do. And then do you worry then as the physician who is now taking over patients for someone they've gone to see it for a long time that you'll get one of those? Well, the previous doctor never did that. Well, the previous doctor always did it this way.
I mean, there's always that challenge, but that's what makes medicine in general interesting. I mean, each patient has their different ways of kind of approaching things, and we talk it over. We sit together, we work as a team, and we go over things. We go over what they've used to get treatment with, and if there's any new treatment nowadays, we kind of give them these options, and we kind of go from there. So it usually works out well.
I think Dr. Diamond's patients are in good hands with you.
Well, thank you.
What's the biggest generation or age gap in one family that you see? Like,
you mean like up to age?
Yeah. Do you have like a 90-year-old grandmother and a 2-year-old?
Yeah.
Like, how big of the gap do you go?
I mean, at our clinic, we say mainly adults, to be honest with you here, because it is an internal medicine practice, and so. But I do see a lot of older folks here, for sure. I mean, geriatric population is pretty big in our clinic here. So I think, I've seen the oldest I've seen so far, at least, is a 98-year-old gentleman the other day, which was rewarding. I mean, it's amazing when you get to really see that. I mean, from young to up to that age, it's rewarding, and you get to really experience, learn from them, and as much as they learn from you. And so it's a rewarding experience.
What is the kind of rule of thumb of when your child should see a pediatrician versus the family doctor? It should be concurrent, or do they graduate to the family doctor at one point? What's that time frame?
I guess if you're talking kind of more adult, I mean, we as family physician, we see everyone. I mean, there's really no age group for peds. I mean, we can see peds from since birth up to 18, and so a lot of people prefer to see pediatricians because obviously that's their specialty, is just pediatric patients. And usually that age group is obviously from birth till a lot of people go to 16 or sometimes 18. Kind of that's when they graduate, I guess you can say, to either an internal medicine or a family medicine physician at that point.
I think that's what mine did. It was at 18. The decision was made. Okay, time to go to the grown-up doctor now.
Yep. No more lollipops.
Well, and that was the complaint. Because, the pediatrician always had goodies, always had at least a couple of good jokes, did all the things that pediatricians do to keep kids engaged, and they were going to miss that. So.
Yep. No, pediatricians are great. Obviously, again, this is their specialty, is what they see every day, and so it does help, especially sometimes to have, especially kids that are like sicker, to follow up with them because they know more. So
one of the big keys to family medicine, of course, is preventative care. What do you offer in the preventative care realm?
So preventative care, that's a wide. There's really a wide variety of testing when it comes to preventative care testing. And this depends again on the gender and the patient's age. For example, let me just give you a few examples here. For example, kids, a lot of times this may involve getting them vaccinations and getting them up to date on that, and also discussing safe practices and seatbelt use and everything like that will prevent illnesses in the future. And when it comes to adults, this also varies based on their age. For example, if you're 45, actually it used to be 50, but now they changed it to 45. Whether you're male or female, you need to have a screening colonoscopy done.
And don't skip that. Don't pass that over. Don't let anybody scare you with any of it. It is it's a much needed procedure, and it is easy as can be to go through.
Oh yeah, for sure. To be honest with you, a lot of people get scared of it, but it's rather pretty easy. It's a quick procedure. The toughest part from that one is just getting the before preparation, which is getting kind of all your colon cleaned out. Otherwise, it's pretty simple. When it comes to the actual procedure itself. So,
and chances are you're not going to remember a whole lot of it anyway.
Yeah, probably won't. You'll be put to sleep. So, so it's not too bad actually. It's pretty easy.
We've talked about how important it is. The family doctor gets to know the whole history of the family. However, you do send people out to see specialists or otherwise. When you do send somebody out to see a specialist, how involved are you still with that process? Do you get daily updates? Do you confer with a specialist, or do you just send them off and get a report when everything's done?
No, so a lot of times we do stay in touch with specialists. They do what they usually do. A lot of times is they share once they see the patient, they share their notes and their recommendations or impressions, and they send them to us. And so we get to kind of read on that and follow up with that. And so a lot of patients, once they see a specialist, you don't really have to follow up with the specialist most of the time. Let's just say, for example, COPD. When we first get it diagnosed, we send you to a pulmonologist to diagnose it, and once that's been done, really after that, treatment-wise, we can treat you here in the clinic, and so usually we get the report that they've officially been diagnosed, and then they start the treatment, and we just continue it here and follow up on them and make sure things are okay. And so, I mean, a lot of times, I mean, it's really it's a pretty mutual relationships with the specialist. I mean, I send people for evaluation, and then they kind of send them back for follow up with us too. And so it's kind of back and forth, and we stay in touch rather often. So it keeps the connection there. So.
I see that you offer a treatment for smoking cessation. Tell us a little bit about that program.
So yeah, with smoking cessation, it's a big area here that we address rather daily in our clinic. Unfortunately, there are a lot of smokers out there, and there are a lot of treatment options that help with this that we can offer. And usually, just to give you kind of briefly, usually I try to keep my visits for smoking cessation separate from other visits, so that I can take the time to work with the patient and provide them with all the options we have available, and allow them to make an informed decision on what options to pursue that will help them quit smoking, and at the same time maintain them off smoking, because that's even more important. Because sometimes it's easy to quit, but really staying off of it is where it becomes a challenge sometimes. And in terms of options, really, I mean, you got anything we offer. We send them out to counseling, the group meetings. We also have oral medications that have been shown to really be very effective. That we also offer. We also offer, nicotine patches, and the gum. I mean, there's a lot of medications out there that are, and every day there's new ones that come out that really work really well, and we've seen good results with them, and the side effects are really minimal too. So overall, I think the options are pretty vast when it comes to smoking cessation, and I really enjoy doing that, because when I get one person just to quit smoking, that's really rewarding for me.
That's got to be successful, and have them go. No, not only did I knock it off, I'm having success in keeping it knocked off.
For sure. That's where the challenge comes in. But most of the time, I think people do really well. So.
Outstanding. Well, I hope you get a lot of people taking advantage of that. And Doctor, from people who have tuned in this morning and liked what you've had to say, how do they reach out to you?
Basically, just call our clinic number, which is 815-971-2790. That's the primary clinic number to make an appointment here at the Mercy Health Perryville Clinic. And just ask for my name, which is Yaser Mustafa. And you can get scheduled. I look forward to seeing you and meeting you and working with you and the family. So
outstanding. Well, Doctor, we appreciate you. We know how busy you are. We appreciate you carving time out of your day for us.
For sure. Well, thank you for having me, and have a great day. Take care.
You too. There's Dr. Yaser Mustafa with Mercy Health.